Take two. Hi, everybody. All right, welcome to Full Circle's mandatory pregnancy orientation webinar. Some of you I just talked to a little earlier today about this because all the questions that you had and they were written down, I'm going to answer them, and even some questions you didn't know you had. So I have a lot of talking to do, so let's get started. Raise your hand if you're able to see my host screen with the presentation. All right, I see hands going up. Oh, and I see some names out there that I know. So, couple housekeeping things out there. Hi. This is confidential, so I can see the names, but other people on the call can't see who's out there. So please feel free to ask questions. No one will know it's you. There are no silly questions. So please feel free to participate. I have some poll questions hidden throughout here to just make sure you're still involved and active. And then if you have to jump off on any part of this, I know dinner time's coming up. This entire presentation will be available on our YouTube channel for the remainder of your pregnancy. So we're going to start out with a poll question just to let you know what those look like. So I first want to know who's on the line. How many first-time mamas do I have, and how many veteran moms do I have? So we're going to flash the question up. I'm going to talk for a little bit. You're going to answer the polls. I'm going to say the polls are closing in 3, 2, 1, and then they'll be closed. And right now it looks like we have a tie, the same number of first-time mamas as mommy veterans. So when you answer the polls, it does kind of help me know how to direct what comes next. So today we'll be talking about the full circle experience, which includes where we deliver, some of our office protocols, including what to expect at your pregnancy visits. Going to give you lots of prenatal resources, so you have your pen and paper ready, and then exercise and nutrition in pregnancy, and we'll wrap up with a COVID-19 update because no, we're not done with that yet. In fact, my office manager and my clinical operations manager were out all for the last 5 days with it because we think maybe someone exposed them here at the office. Pregnancy and birth are normal life processes. That is the fundamental values that we follow as the collaborative midwifery model. In the traditional midwifery model, they do take care of normal low-risk women, but if they identify any abnormalities, like say, for example, you develop some high blood pressures or high blood sugars, or you have twins, you would typically have to transfer out to be in a physician-only practice for a different acuity of care. But in the collaborative model, you get to stay under the care of the midwife with physician direction for any issues that are happening with the pregnancy, which is kind of nice because midwives are the experts in normal physiologic labor and delivery. And so to that end, the majority of our deliveries are attended by our certified nurse midwives. So even if you're doing a VBAC, even if you have twins, the nurse midwives are able to still do your delivery. If you have twins, the physician will be in the room, but you'll still get a nice midwife delivery as well. Now, if there are some things that are outside of the scope of the midwife, then they know how to call us. One of us is always backing up our midwives 24/7. So if it is an urgent call, meaning it's something that cannot wait, some hours or until morning, then either myself, Dr. Mero, Dr. Mooney are always on call for our midwives. They'll call us in. We each live probably about 20 minutes from the hospital. If you do not have 20 minutes, where we deliver it for true emergencies, there is a group called the OB Hospitalist Group. It's there 24 hours a day with board certified OBGYNs ready for any true emergencies. To put it in perspective, true emergencies, we had almost 550 deliveries last year, and only 3 times did we use the hospitalists. And to take it even further, the emergencies were that no one was there and the baby was getting ready to come out. So it wasn't anything catastrophic that was happening. It was actually something physiologic. The baby didn't have a clock and didn't know that we were not there. So that's the most common reason why we use the hospitalists. So where we deliver, for those of you who are with us for previous pregnancies at Ascension, we have made our transition since last October to HCA Florida Memorial Hospital, which is less than 10 minutes from our office. They are doing tours. They have stork tours, which are held quarterly. I think the next one is actually next month. So when you come in for your visits, on the walls, you'll see the dates for the next tour. Oh, no, wait, it's next week. And I'll be speaking. No, that's doula day. It isn't next month. But if the times on the wall don't work for you, they do one-on-one tours as well. And so they do them on the weekends, through the weekdays, in the evenings, whatever's convenient for you and your family to come and see the space, because we want you to be familiar with not only where the hospital is located, but what the unit is going to look like, where you're going to to meet your little one or little ones. All right, so office hours are next. So our office is open Monday through Thursday from 9 to 1. We then close for lunch from 1 to 2, and then we open back up at 2 and we close at 5. So if you call the office between 1 and 2, you will get the after hours line. It's not broken, the phone isn't broken. We set it up that way so that if you have a medical emergency between 1 and 2, the after hours line automatically rings to the on-call provider. So if you're calling between 1 and 2 and you have something administrative, like you need to change your appointment or something like that, please don't leave a message for that on the after hours line, because the emergency on-call person can't do anything about it. And she's not in touch with the front desk to let them know either. So just wait until after 2 and give us a call back, and we can handle whatever's going on then. On Friday, we are open from 9 to 1. So if you're calling with something administrative at 12:55 on a Friday, there's a chance that we may have to answer that request on Monday when we reopen, unless it's a holiday. All right. Also, we do not have walk-in appointments typically. We don't have walk-in appointments. There are a limited number of same-day appointments available. Sometimes patients cancel. And if you're calling in the morning with the situation, you think, hey, I really need to be seen today. If there is an appointment time later in the day that we can put you in, we're happy to fill that up. But for the most part, you all know our appointment slots are usually pretty full. We do not double book. So if I promised you the 11:40 spot, the 11:40 spot is yours. I'm not going to give it to someone who walks in at 11:38 with a problem. But if you do call and it's an urgent matter that we're saying, that probably shouldn't wait until 2:40 this afternoon, we may recommend that you go to labor and delivery or be seen in urgent care. It's not us saying we don't want to see you in the office. It's us saying that we agree this is an urgent matter. You do need to be seen, and not just sitting in our lobby waiting for someone to fall off the schedule so that we can work you in. Because remember, our goal is to see you as close to your appointment time as possible. Great. If you are calling, remember providers are not able to leave appointments to take patient phone calls. So that still also goes along with your appointment time is your appointment time. You get our undivided attention during that time. So if you're calling with a message for a specific person, one, you have to leave a message in order to receive a call back, because people pocket dial their gynecologist a lot. You'd be surprised. But do make sure that you leave a message. And if it's something like a clinical question, we do have a nurse here who does triage phone calls, and she can answer most of the questions that people have: spotting, wondering about baby's movements, are these contractions normal, that sort of thing. So when you leave your message, be sure you're leaving it with the right person. The question I have here is there a difference between the stork tour and the regular one? No, it's the stork tour is just the tour of the facility. That's just their cute name for it. Good question. All right, so Tony is our nurse who does clinical calls. She is also the point of contact for letters and forms, like disability forms and triage. Many of you have already heard from Naisha, my OB clinical coordinator. She does referrals. She's the one who sent you your blood work, your lab work, if you've already received it, if you did your history visit with me. If at the end of pregnancy you need something scheduled, like an induction or a C-section or a version, she's the one who does that, and she schedules the circumcisions as well. Everyone on the call has probably had a conversation with Renee Hall, who is our benefits expert. She's the one to let know if there's anything different about your insurance. So if your insurance changes, I know this group, we have a lot of people who are going to be pregnant into the next year. If your insurance changes, please let Renee know so that we are not still collecting on an old prepayment plan that doesn't apply anymore, because it's not our goal to tax you unnecessarily. Or if there's anything that you don't understand, or something changes, like you're meeting your deductible and you feel like you no longer need to pay that, please run it by Renee so that she can adjust as necessary. All right. After hours, there is always someone on call for our practice from our practice. Usually it is one of the midwives. So she is the emergency on-call provider, meaning she's also the person in the hospital who is taking care of admitted patients. So please call her if you think you need to join her in the hospital. But you do have to leave a message on the phone to receive a call back. You just call our regular normal business hours number and you'll follow the prompts to get to the after hours on call person. And so this isn't, for, hey, can you resend my lab slip or refill a prescription? This is, I think I need to go to the hospital. Like this baby might be coming out. All right. Next, the other way to contact us is Patient Portal, but please remember that Patient Portal can take up to 2 business days for us to respond. So this is not something that is for urgent matters, but we also want to stress that the Patient Portal is for things that cannot wait until your next visit. So not things like, oh, I really want to drink this tea, but I'm not sure whether or not I, can drink this tea. That is something that, I mean, unless you're, going to have tea with the British royalty and you may create an international incident, the tea can probably wait until your next visit because you'll be seeing a lot of us. So if it's a non-action item, we might pass it to the person who's going to be seeing you next or say, hey, this is a great question. Please bring it to your next appointment so that we can get through our portal messages and spend time with our families because this is what we do in our spare time after we're finished seeing patients and charting and reviewing labs and stuff. So a good use of the portal is things like I lost my lab slip. If you need Naisha to email you another one, or I have COVID, I think I need to cancel my appointment or transfer it to a virtual visit so that you're not coming in and infecting the staff here. Please and thank you. It's also in the portal, though. Please don't send urgent matters. So this is not the place to write us about elevated blood pressures, not feeling your baby move, heavy bleeding, because 2 business days is not an appropriate response time for those sorts of things. Those are emergencies. You need to call the emergency on-call person. So once you've sent a message, please give us the full 2 business days. So please don't blitz message. If you haven't heard back from Lauren in 2 hours, you message Jane. You haven't heard back from Jane in 2 hours, you message Dawn, and so on and so on. Multiple messages, because I've seen people cut and paste the same message to 5 people and then be very upset with us when they have 5 prescriptions waiting for them at the pharmacy because you message lots of people and so we're all working on it. It's not clear what the directions should be for you and it's not efficient use of our time. And the computer might think that you're a bot trying to spam our table space and delete your account. So we also ask that you don't attempt to have a visit via the portal. You have questions that are open-ended questions like, hey, Dr. Adams, what are your thoughts on this, and what are the chances of that? That's a visit. Text yourself that question or schedule an appointment because we're happy to talk through any of those things during our business hours when we have set aside to have appointments with you. We love talking to you during business hours. The patient portal is also where we release your ultrasounds. Unless there is something urgently abnormal noted. So our sonographers are very good. They've been doing this for years and years. They know if there's something that requires a plan right away. And in those events, that is the one time they will come and pull us out of appointments to talk to you on the same day. Otherwise, they have to prepare their reports, which are then uploaded to the portal and distributed amongst the providers. So please give us a chance to receive your report, review it, and release it to the portal with our commentary. If you know that your anxiety will not allow you to wait 2 business days to find out what's on the report, please make an appointment after your ultrasound, like make 2 appointments on the same day, because sometimes there are preliminary reports that your provider can go over with you to answer a specific question so that you're not having to wait 2 business days to find out what the results are. You know who else has a portal? Quest. It's kind of annoying too because they'll send the results to you, but not to us. And then you get the results and you see all this red on the paper and it freaks you out. But please remember that red does not necessarily mean abnormal. Pregnancy reference ranges are different than the ones that they use. The ranges they use are for non-pregnant people, and there's some physiologic changes in pregnancy that make a red actually normal for pregnancy. So please give us a chance to receive the labs from Quest, review them, and release them. Please don't send your own copy of the results because we need it to come from Quest to close our loops. You know, computers are about closing loops. If you've had the results for a week and you have not gotten them from us, though, please just let us know so that we can reach out to Quest to receive the results from them to, again, close the loop. All right. Any questions about how to contact us, scheduling visits, or any of that stuff? All right, cool. Let's move on. What to expect at your prenatal visits. So, first thing to expect is that you are going to forget all the questions that you have as soon as you walk through the door. So please start a text thread with yourself about your questions so that when you come in, you'll be all ready to ask us everything that you mean to and not forget anything so that we don't have to communicate later on after your visits about things that you knew you wanted to ask. We want you to wear loose, comfortable clothing so that we can access your belly. Every single visit, we will be listening to the baby's heartbeat. If you have twins, we will probably be looking early on to make sure that we're catching both of them. But for most, like with an ultrasound, but for most visits, we will not be doing an ultrasound every single time. We'll be listening with the Doppler. We ask that you arrive a minimum of 5 minutes before your scheduled appointment so you have time to check in and handle insurance things with front desk. We are not routinely leaving urine samples anymore. That's a change for some of my veteran moms. But ACOG says we only need to be checking if we are following someone for high blood pressures, looking for protein, or high blood sugars, looking for glucose. And we add in if you had a recent test or treatment for urinary tract infection to make sure that everything is clear. So front desk will have a note knowing if you need to leave a urine sample. Otherwise, we know you're pregnant, you've been drinking your water, hope you've been drinking your water, and you need to run to the bathroom. So go right ahead. If you're 10 minutes late, we'll still have time to check on you and your baby. It obviously leaves less time for our text thread questions. And if you're 20 minutes late, you've missed the entire appointment slot. We'll try our hardest if there is an open slot a little later in the day. Front desk is really good about saying, oh, she's going to miss this 2 o'clock. There's a 2:40 right there. She can wait. We can put her in there. But if there isn't anything available or that time doesn't work for you, then we can reschedule to a time that is mutually beneficial for both of us. We understand sometimes there's traffic, and if everybody is held up by 10 minutes, we're not barbarians. We're not going to kick everybody out. But we try to respect the person who's after you, who's there on time and wants to leave on time as well. Diagnostic ultrasound visits. So the next question I always get is, when am I getting another ultrasound? That was so much fun. They are. Just know that diagnostic ultrasounds are separate from prenatal visits. So if you are booked to see one of the midwives or physicians, we're not scheduled to do ultrasounds. Way to know whether you have one scheduled is to look on your portal and see if you have more than one appointment time and whether there's a provider's name associated with your visit. So my imaginary patient, Tina Test, logs into her portal and she clicks on appointments. And there she sees that she has 2 appointments scheduled on the same day. The first one at 9:20 is with ultrasound, which is not a provider's name. Tina has an ultrasound scheduled. Then she has an appointment at 10 o'clock with Dr. Yeckel. Dr. Yeckel is a provider's name. So she has that appointment scheduled as well. So she can tell her family, hey, be there at 9:20 to see the baby. And if you want to stick around and hear about what we just saw, then we'll hang out with Dr. Yeckel at 10 o'clock. If you know you're supposed to have an ultrasound and you look on your portal and you don't see one, please reach out to us because the ultrasound schedules fill up quickly too, and we want to make sure that we are looking when we're supposed to look. And I think that's what the next slide says. Remember again that the results are sent to the portal within 2 business days. Unless there is something urgently abnormal, in that case, we will not let you leave the building without discussing those results and making a plan. So when you're checking out for your visits, say you're at your 16-week mark and you know you're supposed to have your ultrasound coming up in a month, let the front desk know when you need a prenatal visit and diagnostic ultrasound visit so that they can schedule both of them. You should be leaving with 2 separate appointment times if you have ultrasounds due. All right. If you want to look at your baby more than we medically need to look at your baby, there are boutique ultrasounds, which are perfectly safe because ultrasounds are not radiation, they are just sound waves. I have listed here a couple of places around the city, which are for fun ultrasounds. These are just, like I said, for informational purposes, not endorsing any one over another, but they do really cute stuff like put the baby's heartbeats and stuffed animals and give you all these 3D pictures. And they even do sneak peek for baby sex right around 14 weeks or so. So take a look, take your family and take a look at the baby. All right, I have a poll question for you. When should you expect to do routine ultrasounds? All right, will we do them at every visit? Will we do them at 20 weeks, 40 weeks, and if you go past 41? Or do we only do ultrasounds if you have a problem? And the polls are closing in 5, 4, 3, 2, 1. Awesome. All right, very good. 20 weeks, 40 weeks, and 41 plus weeks. So 20 is typically when we do the anatomy ultrasound. With twins, we might do it a week or two earlier because we can see more when they're just a little bit smaller. But then if everything looks good, because the key word here is routine. If everything looks good there, then you won't need another one until you're past your due date. Non-routine ultrasounds are if we find something that needs more investigation or more clarification. And then everyone gets post dates, post due date testing. All right, we are headed over, I believe, to the website now. So this is fullcirclejacks.com. And for those of you who missed our town hall in October, which discusses why we moved from Ascension to HCA, you can click on the banner at the top. There's a blue here, click there, and you can see the first, like I think the first 15 minutes of it is why we really go into it. But it's been a fantastic move. I think we might be up, I know we're over 400 deliveries there now, and it's just been an amazing experience front to back. So those of you who delivered at the other facility before will really enjoy this new situation. All right, so let's start with the providers because one of these lucky ladies will be fortunate enough to join you and your family in welcoming and growing. There's me up at the top with more hair. There's Dr. Marrow next to me. There's Dr. Yeckel, and there's Dr. Mooney. Then we have midwife Lauren, we have midwife Krista, midwife Cindy, midwife Dawn, midwife Missy, and midwife Jane. And everybody on this page is doing their favorite thing to do, which is take care of mamas and deliver babies. And that's why we're smiling. You can click on our names to learn a little bit more about us and find out some of our bios and things we might have in common. All right, let's go over to patient information and see the obstetrics tab. So you'll know you're in the right place because you'll see all the growing bellies and end up with the baby there at the end. Our delivery stats are first on the page, and many of you are here because of these stats. This is your risk for C-section if you're a first-time mom, your chance at a VBAC if you had a previous cesarean, and our stats are there back to 2018, I think was when we actually started collecting them, and no coincidence, that was the year Dr. Marrow joined us because I was running too crazy to be able to deal with numbers prior to that. But anyway, the next box is our prenatal care timeline. And so this is what to expect at each visit. So everyone on here has had their confirmation of pregnancy visit, which was the ultrasound followed by a wrap up with one of the midwives. So at that point, we should have set the due date, and sorry, it's should be a little bit bigger, I think. We should have set the due date, and then you would also watch the video with me saying, hey, your next visit in the office is going to be virtual. And the virtual visit is your history visit with me, where I go back through your medical history, any pregnancy history, any genetic history, and we talk about how any of those things will affect your pregnancy, and we make a plan for it. At that visit is where I will order your regular prenatal labs along with any other labs that we may decide we need based on your individual history. And your homework is to try to get that done before you come back to the office. Let's see. And then at this point in the pregnancy, we're seeing you every 4 weeks. So some of you will opt in for the optimal genetic test, optional, genetic testing, the NIPT, which is done after 10 weeks, or the nuchal translucency ultrasound, which is done between 12 and 14 weeks. But about 4 weeks after your initial confirmation, you are back in the office for another physical visit, no pun intended, for your actual physical. Your physical exam, which is just a regular physical. So we listen to your heart and lungs, your abdomen. We do a pelvic exam with cervical cultures. So going back to that first box, the labs that you see on there, we do have lab transparency. So you'll know by looking at this document what labs we're ordering at what point during pregnancy. So blood type, blood count, serologies, urine culture, and cervical cultures are part of the ACOG panel for prenatal care. If you are due for a PAP test during this time, it's not part of the panel, but a lot of people say, hey, I'm due, and since you're down there, go ahead and do it. But it is not required that you have a PAP test at this time. So that is totally up to you if you want to defer that until after pregnancy. Then 4 weeks later, you're back in the office. Usually, people who have any high risk issues, we talk about that during your history, and you get your referral to the high risk doctors around the same time you're coming back for your physical exam. And that's usually when they will reach out to you for your first appointment. So at the 4 weeks after that is when you come in for your second trimester belly check. And then 4 weeks later is right around 20 weeks. So that's when we're looking at our anatomy ultrasound. If you meet with the midwife around that time too, she'll be talking about childbirth education classes and or breastfeeding classes. You'll see there in the middle two mental health screens. So we routinely screen at least twice during pregnancy, everyone for anxiety and depression, because pregnancy does come with its own emotional ups and downs. And people who have a history of those things are at increased risk for antepartum and postpartum anxiety and depression. We want to get ahead of it and not be reactive to it. So about 4 weeks later is when we look at the glucose testing. And I know I have questions about glucose out there, so don't worry. We're going to put a pin in it, and I'm going to talk extensively about glucose testing in a moment. My moms who have a certain blood type, Rh negative, we will test and find out whether or not you need to have ROGAM, and we'll talk about those individually, what the options are for ROGAM. But if you do need it, we give it between 28 and 30 weeks. This is when you will complete your pre-registration at the hospital, which at HCA is all online. Yay, no more paper packets. If you're planning to work with a doula, which we'll talk about in a moment, you want to have her secured by this time and be sure you have toured the hospital. All right. And after this is when we start seeing you every 2 weeks. So we begin to ramp up. You'll see there in the middle the option to repeat or decline your standard prenatal labs. Completing them once is an ACOG recommendation. Repeating them is a Duval Health Department recommendation. And as you know, they cover multiple different stratifications of risk and population. So if you feel you are low risk for contracting an STI during pregnancy, you can opt out of them, and we have a form that you can sign for that. Over there in that third box, you see things about third trimester vaccinations like Tdap and flu and RSV and all those things. We don't actually have them here in the office, but if you're interested in getting them, we can give you the resources to Minute Clinic or your primary care physician for those things. My moms with any pregnancy complications like high blood pressure or diabetes will start your antenatal testing. The non-stress test where we listen to baby's heartbeat. And then we continue with the every 2 week visits until 36 weeks. If we already know that you're having a belly birth, which is our term for a planned cesarean, then we try to get you that date right around when you're 32 or 33 weeks, just so you can start planning for the 39-week mark. At 36 weeks, there's one more pelvic exam where we screen for group beta strep, and we'll explain what that is and why it's important. And if you've already opted out of third trimester labs, then you've also opted out of repeating cervical cultures. This is when we start seeing you every week, and you're going to prepare your birth plan after this because, yeah, you're full term. And we see you every week until about 40 weeks, and then we start seeing you more than that because we want to do testing to make sure that it's safe to go past your due date. Standardly, expecting a scheduled belly birth is around 39 weeks. There are some circumstances that make it a little sooner. If you've had fibroids before, the placenta is covering the cervix, and twins may make it a little bit earlier. Everybody out by 42 weeks for singletons. And so if you are a second-time mom, 41 weeks and 6 days is typically when we'd like to schedule an induction. For first-time moms, 41 weeks and 5 days, because your labors typically take a little longer. The average length of time for labor for a first-time mom is 24 hours. So just know that going in, it may be a little bit longer, especially if we are starting it. And so just know that labor inductions can be 24, 36, 48 hours, or even more, whatever time your baby and your body need. All right, headed back to the presentation. I also have a poll question. If you have a headache, are you more likely to take a Tylenol, meditate, or go to the ER? All right, the polls will be closing in 5, 4, 3, 2, 1. All right, and it looks like we have more caters than meditators this time. All right, but I'm glad we have no evacuators. No one's going to the ER for this. So some of you have said, well, I have a lot of pregnancy problems and I can't take anything because I'm pregnant. False. Check here under pregnancy safe medications. So I have here a list, alphabetized list of common pregnancy discomforts. And you'll see that like they're all on the website. And in the middle are relief measures. So things that you can try first to help with the discomfort. So if you send us a message, because I do get these messages still, Dr. Adams, I'm really constipated. What can I do? My first question is always going to be, have you tried everything on the website first? And then it's like radio silence. But sometimes y'all have gotten smart and you send a message, okay, Dr. Adams, I've tried everything on the website and I still have this cough. What else can I do for it? So if you've tried everything here and nothing has helped, then please let us know so that we may either need to evaluate you or move up to prescription medications. But this is 2 pages of good stuff, things that we recommend and even some things that we don't recommend, like pseudoephedrine, Pepto-Bismol. And on the second page, you'll also see a warning about nausea and vomiting, about not being able to keep food or drink down for more than 24 hours. That is something that we need to know about because you need some IV fluids. So just remember that this is out here, a couple pages, and you can download it, you can print it out, stick it on the fridge if you're old school like me, and that will always be available for you. Gestational diabetes screening tests. Again, remember that this box is out here. We're not going to click on it right now because, as I said, we'll be talking about gestational diabetes shortly. Weight gain in pregnancy. Some of you are very concerned already because you've either not gained anything in your first trimester or you gained too much in your first trimester. So this is your recommended pregnancy weight gain. So there's a link here at the bottom you can click on and put in your pre-pregnancy height and weight, and that gives you your pre-pregnancy body mass index. Based on that number, it tells you how much to gain for the whole pregnancy. If you have twins, you can add 10 pounds onto the top number there. But you'll see there in that third column that the rates of weight gain are in your second and third trimester per week. So it's okay if you are nauseous and with decreased appetite in your first trimester. That's not when we're expecting you to gain weight anyway. Your baby is gaining. You may lose as your baby gains, but don't worry, it will come back. You'll see that weight again in your second and third trimester. All right, then we go back to the presentation and we see birth preferences. So if you're planning to make a birth plan, this is sometimes very helpful, especially for my first-time mamas, because you've never done this before and you don't know what to expect. And sometimes writing some things down can help take some of the anxiety out of that process. So there's lots of choices on here, everything from how you want labor to start to what you want to wear in the hospital, what you want to eat or drink, how you want to be hydrated. So one thing I want to point out is that we do not strap you into the bed and starve you. We want you to get up and move around and be an active participant in labor. On the next page, you'll see things about common medications that are offered to the newborn and, excuse me, as well as breastfeeding choices. So you always have the option to bring this in, talk to the midwives about, hey, what is this for? What does this mean? Does this apply to me? Do I want this? And we're happy to help you go through it. Doulas are also very helpful with making birth plans because nothing on this list is dangerous. These are all matters of preference and opinion. So it might look daunting because there are 21 boxes, but not all the 21 will apply to you. You can see there's twin deliveries on there too, as well as belly birth, because we do practice gentle cesareans here, which is a concept that that if you are looking to have a belly birth, like if we know that we know you're going to have one scheduled, we'll talk about that concept with you as well. All right, so just remember this is out here for at the end of pregnancy when it's time to make some choices about what you want to do. You decide, we deliver. Cervical ripening techniques, also along the lines of what happens at the end of pregnancy. So things like clary sage, evening primrose oil, raspberry leaf tea. At the end of pregnancy, your question is always, how do I get this person out? Or these people out? And so these things don't put you into labor, but they can make your cervix softer and help to tone the uterine muscles to make your contractions more effective. So you guys can read week by week the things that we recommend there. And the thing that you will notice is not on there is castor oil, and your midwife will be happy to tell you why that's not on there. All right, back to the presentation again. How many moms do I have on here who've had C-sections before and are looking to do a vaginal birth afterward? There are only two options here. Either you've never had one before, which is going to be all of my first time mamas, or yes, and you're going to rock it. All right, the polls are closing in four, three, two, one. That's it. Okay, so I don't know that this actually means that I don't have anyone who's trying for a VBAC, but this information here is really good for first-time moms as well, because you are both essentially doing the exact same thing. You're trying to control what you can to avoid an unnecessary C-section. So, Webster certified chiropractor we'll talk about in a moment. Yoga and Pilates we'll talk about as well as into also squats. Method classes, watching your weight gain, having an experienced doula, monitoring baby's position is huge for first time moms because the most common reason we are doing C-sections now is not baby's too big or baby's in distress. It is baby's head is in there crooked and can't pass through the pelvis like they're supposed to. And just trust us because if we're recommending something, remember we have the same goal. We don't want you to mess up our stats. We have really good delivery stats. And so we're not going to recommend something that's going to increase your risk for having an unnecessary cesarean. All right. Then the last thing on there is circumcision. If you have a little guy and you want to have him circumcised, we do those in the office within the first 10 days of life. So what will typically happen is once you deliver, the midwife will ask, did you plan a circumcision for him? And then our OB coordinator, Naisha, will reach out to you via the portal with his little appointment time. All right, so full circle jacks, remember all this information is out here. We're going to head back to the presentation to have a conversation about nutrition because those who are very concerned that they are gaining weight, but all they're drinking is coffee. Are you, or are you drinking one of these salted caramel mocha monstrosities that I absolutely love? So much sugar. All right. Did you know that pregnancy only requires an additional 300 calories per day, which is not a whole lot? I know. It takes 10 kilocalories to maintain a pound, and your goal weight gain, as we just mentioned, is based on your starting body mass index. So if you're starting the pregnancy at 170 pounds, it takes 1,700 calories to maintain that daily. If your goal weight gain is 25 pounds, then that's 250 additional calories for a total of 1950. Then if we divide that by breakfast, lunch, and dinner, 650 calories per meal. So, which is fine. You can eat 650 calories, but if you then wash it down with the 570 calorie mocha monstrosity, then yes, there's a good chance our calories are going to spiral out of control and we will get to keep all of that weight after baby takes his or her or their 300 calories. And actually, twins, you all need more, remember? So you get to add 10 on there. Things to watch for, there are simple changes that you can make that can make a big difference. Swelling in third trimester is a big deal. We want you to keep your sodium down. So little changes, doing herb infused marinara instead of traditional spaghetti sauce can save you over 500 milligrams of sodium per serving. Watching your carbohydrates at 40% of your intake and your protein, which we're going to talk about in just a moment. So, what sorts of things should you be eating? Fruits and veggies, yes, whole grains and cereal, absolutely. You will not give your baby a nut or dairy allergy by eating these things, so enjoy. For my coffee drinkers, you want to keep your caffeine at less than 200 milligrams daily, which is still a lot of caffeine. Like that's like 4 tall Starbucks. That's a lot. And remember, caffeine is a diuretic. So if you are drinking that much, please use the 3-to-1 rule. Take in 3 times as much water as you do caffeinated beverage to keep yourself hydrated, especially in this miserable heat. Herbal teas are fine, and our favorites for pregnancy are raspberry leaf, ginger, lemon, and peppermint. For my vegetarians and my bodybuilders who are eating lots of protein, please keep your protein around 70 grams daily, not more than that. You will grow a 10 or 11 pound baby. Please don't do that to both of us. But 70 grams is enough to support, and that is actually the same for twins also. You can have deli meat as long as you microwave it for 30 seconds. Just to make sure you kill all the harmful bacteria. It doesn't have to be piping hot when you take it out of the microwave. Like don't burn your mouth, but microwave it for 30 seconds. Soft cheeses, if they're made with pasteurized milk, are just fine. If you can't flip it over, like you're at a restaurant and you can't tell, is this brie pasteurized? Then maybe you skip the soft cheese for that night. You can have 3 4-ounce cans of tuna per week. If you are pescatarian and you need to eat more fish than that, please take a look at this document from the FDA. Has foods that fish particularly, that you should be eating in larger amounts because they're high in DHA, which is good for baby's brain development. Those that you should eat in moderation, and those you should eat sparingly because of methylmercuries or toxins of that nature. Things you want to avoid: undercooked meats and fish. So, my steak lovers, you will need to ruin your steaks and make them well done for the next 6 months. Sorry. Yummy ahi tuna is not for you. Any fried sushi is okay. My kombucha drinkers, my kimchi eaters, those are fermented beverage and foods, so you want to limit those. Alcohol, also, we do not know what the safe amount is in pregnancy, and so we don't recommend any particular amount of alcohol. And you want to keep your sodium at under 1,500 milligrams per day. Once you start flipping your food over to see how much sodium is on those nutrition facts, it will be appalling to you how much sodium is 1,500 per day. Like, it's not very much food unless you're making not great choices. All right, any questions about food? I know we have lots of people who have questions about exercise, so that's what we're going to move to next. It is just fine to continue your pre-pregnancy exercise regimen unless your pre-pregnancy custom was to do nothing. Only difference is you will not feel like doing it. So in the first trimester, everyone is sick, everyone is tired, no one has an appetite. But in the second trimester, you increase your blood volume by 50%, which increases your oxygen tension and saturation. And that physiologic change accommodates more physical activity. So just listen to your body. You will become the, gladiator you were before pregnancy, but just slowly and take your time, building back up to your previous level of activity. If you were not doing anything prior to pregnancy, please start doing something so that we do not have a crooked little baby in there when it's time to deliver. A sedentary lifestyle leads to malpositioned babies. Also, the work from home crew, get one of those birth balls so that you are not slumped back like this in your chair, but sitting forward with good posture and encouraging the baby to descend straight into the pelvis. Those of you with these Fitbit watches, your resting heart rate will rise 10 to 20 beats per minute. That is normal. That is physiologic. If you are not getting dizzy and passing out from it, don't worry about that, because that is what it's supposed to do to accommodate the other pregnancy changes. All right. For those of you who are saying, "Oh, I walk a lot and that's my exercise," walking is considered exercise if, when you walk, your heart rate is in the aerobic zone, which is 70% of your max heart rate. Your max heart rate is 220 minus your age. I'm going to get this question as soon as I go through this little algorithm. So if we start with 220, let's say you're 30 years old, your max heart rate is 190. So you should not be exercising with your heart rate sustained above 190 for extended periods of time. 70% of 190, though, is 133. So if, when you are walking, your heart rate is between 133 and 190, then walking is exercise. If, when you are walking, like just around the house or out to the car, that sort of thing, your heart rate is still between 80 and 100, then your walking is transportation, and we can find some other type of exercise to do. The question I have here is there a healthy version of pre-workout that I can take? That is a specific, I'd have to know exactly what is in it. I know that's one of the protein things that you have before exercise to keep you from getting the muscle cramps. So what I would encourage is just bring the version that you have to the office, to one of your visits, and let one of the midwives take a look at it, and they can tell you whether that's appropriate or help you look up another one. Great question. If you like cardio, go for it. Treadmill is fine. Elliptical is good. Running is great. Outdoor, well, I mean, outdoors is like 100 degrees. Don't do that. You'll pass out. Swimming is excellent because your belly is weightless and your joints move a lot easier. If you have an indoor bike, like you're a Peloton rider, my leaderboard name is Off My Meds 8. If you follow, I do follow back, and we can exercise. See, I haven't exercised this week. My wife telling y'all to do it. Other things that you can do: if you were lifting weights, up to whatever you were lifting prior to pregnancy, that's where you want to plateau. Don't continue to add resistance, because your baby and your body will add resistance throughout the pregnancy. If you were already squatting, carry on at whatever level you were. If you weren't squatting, you want to build up to at least 50 squats a day. So if you want to start at 20 weeks, give me 5 squats a day. 21 weeks, give me 10 squats a day, and continue to work up until we hit about 50. Pilates and yoga are some of my favorite pregnancy exercises. Anything long and lean about stretching these muscles and opening these ligaments and hips. Any experienced instructor will be able to tell you what the pregnancy modifications are there. The exercises that you want to avoid are high intensity interval exercises after your first trimester. The intervals are fine. You can do the low impact version of them, but the high intensity, those sudden jerking movements after first trimester, we don't want to shear the placenta off the side of the wall of the uterus. Anything that has you lying flat on your back for excessive amounts of time, like excessive ab work or hot yoga, unless you're a hot yoga instructor and are fully acclimated to that exercise and environment. Scuba because of changes in barometric pressure, decreasing oxygen to the baby. Same thing for high altitude hiking. You're fine around 8 or 9,000 feet above sea level, but after that, we don't recommend being out there for extended periods of time because of decreased oxygen. You can visit your family in Colorado, just don't go hiking with them. No contact sports like kickboxing. We've had some weird pickleball injuries recently. So anything with balls and paddles flying at your belly, if you can avoid that, please and thank you. And outdoor biking after 16 weeks is not a no. It's just an asterisk to remember that your center of gravity changes right around 16 weeks. And when you try to make turns, be careful, like turn wide so that you're not tipping over because now your balance is different. All right. So, poll question. Now that we have talked about exercise and nutrition, is it possible to prevent gestational diabetes with diet and exercise? And we will leave the polls up for 5, 4, 3, 2, 1. Excellent. All right. The answer is no. You can't prevent it. Half and half here. My veteran moms probably know because they've heard my stance on this before. The reason why we screen everyone for gestational diabetes is because of your placenta. You know how when you're not pregnant, you're like, I don't know what's going on. It's got to be my hormones. Well, your placenta gives off hormones that tell your insulin not to do its job. So, your insulin has one job, and that is to clear your body of excess glucose. So, if your placenta is there saying, hey, insulin, take the day off, and then you have excess glucose circulating, that is the definition of diabetes, but it is gestational diabetes because it's caused by placental hormones. So, if you can figure out how to do this pregnancy without a placenta, then I will not screen you for gestational diabetes. And if you have twins, you have two placentas. So, I'm absolutely going to screen you for gestational diabetes. It's my moms who say, but I never eat anything with sugar, Dr. A. Now, you eat good carbohydrates, so don't avoid your good carbohydrates prior to taking this test, fruits, whole grains, and things like that. If it is the actual drink that makes you say, oh, I don't want to do that, we have options for the drink. So remember that little box on the website that we clicked on before, that we didn't click on before? That's out there and it has all the instructions on what not to eat before the test, how long not to eat before the test, and alternatives. In the office, we have the Simply Pure drink, which is soy-free, it is dye-free, it is gluten-free, it is BBO-free, it is kosher, it's vegan, it's offensive to almost no one. It's just glucose. And on the website, you will see links for glucorganics, fresh test, and glucose tablets, if those are more palatable options for you. But let us know if you plan to use any of the alternatives because one, Quest does not allow outside glucose sources. And for LabCorp, we just have to write on the requisition that patient is going to bring her own drink or glucose source to make sure that they accept it. The question I have here is my prenatal say stop taking 4 days prior to blood work to ensure accurate results. Have you seen this? I have not seen that. And so I can't imagine if the only thing I can, like, if that's specific to the glucose test, if it has more than 5 milligrams of glucose, as long as you take it more than 2 hours prior to testing, you should be fine. All right, preparing for birth. So those of you who are looking for method classes, so these encompass hypnobirthing, hypnobabies, Lamaze, Bradley. And again, these are for informational purposes only. There are lots of childbirth education methods and classes out there. And Jacksonville's very fortunate to have a lot of instructors for all of these things. So not specifically saying you have to go with one of these four, but these are the ones, that we just thought of first at the top of our head. Next question I have is workout question. Is rebounding workouts a no-go, even if it's simply wellness bouncing for 30 minutes or less? And if you're talking about wellness bouncing on the bouncing ball, there are actually pregnancy wellness bouncing workouts. And Fourth Trimester Fitness is an organization in town that specializes in pregnancy workouts on the birth balls. And if that's not what you're talking about, then feel free to drop another question in the chat there. As you're preparing for birth, we talked about the midwives referring to breastfeeding classes. La Leche League has them, and our hospital does have certified IBCLC lactation consultants as well. Every new parent should know how to do CPR, even if you know how to do it on adults. It's not just doing it with one finger instead of using your whole hand. There are some different intricacies for doing CPR on children and on infants. Chiropractic care, if you're already seeing a chiropractor, yay. Please be sure that he or she or they are Webster certified. That is a special certification for pregnancy that deals with how pregnancy changes the way your body is shaped so that your adjustments are safe and beneficial to baby's presentation. All right. Who on here is planning on working with a doula? I know some of you have already contracted with doulas. I'm super impressed. We're going to close these polls in 5, 4, 3, 2, 1. All right. And some of you are not sure what a doula is. And I'm glad you asked because doulas are there for emotional and physical support. They provide that support before pregnancy, during, sometimes they'll come with you to your prenatal visits if you're having trouble understanding things, and after pregnancy. So during labor, things like breathing techniques, helping you change positions and helping you do relaxation strategies during labor. They're not necessarily just for people who don't want an epidural. Like anyone can benefit from having what I call a safari guide there in the room with them. Remember, your midwife is taking care of all hospital emergencies, so she may have 3 laboring patients at a time. Your doula typically has one person, and she is devoted to you. The best doulas that we've worked with are the ones who come to your house, like when your labor starts, they come with you to the hospital. They do not leave your side until your baby is out and latched and breastfeeding and all of that good stuff. Doulas are not, while they are part of the medical team, they're not clinicians. So they're not giving you medical advice. They're not providing medical care. They're not delivering the baby or prescribing medications. They are not there to advise you on courses of treatment or on specific algorithms, but they're to help you process your feelings about recommendations from your clinical team. And so if you are wondering who you might match up with for doula care, ask the midwives. They have no shortage of opinions on who the doulas are, who they have seen support our mamas the best over the years. Question here, does the midwife not help with breathing during L&D too? Can you compare, contrast them? So the midwife helps when she's in the room with you, but the midwife, as I said, is also likely taking care of multiple patients on the unit at a time, as well as manning or womaning, whatever, the call phone and all of those things. But your doula is the person who you hire to be there. And also your midwife's not going to come to your house prior to and say, let's walk around a little bit, let's do some squats, let's get into these different positions. So when your midwife comes in, yes, she will help with those things. And frequently, like they're in the room for, an hour here or an hour there, but they're not constantly with you from the time that you're admitted until you deliver. And the question here is indoor mini. Oh, okay. So back to the rebounder questions. Indoor mini trampoline workouts, rebounder. The wellness bounce is avoiding the full jumping motions, like a senior citizen bounce. Yes, if it is a lower impact version, then that is acceptable. Thank you for clarifying that. As I said, ask the midwives with regard to whether a doula is right for you. Ask your midwife if a doula is right for you. Acupuncture, when you come out of the front bathrooms, you'll see a wall of business cards. Acupuncture and pregnancy massage are on there as well. We do for pregnancy massage, a lot of places won't do it in first trimester because of just unrelated increased risk of miscarriage in first trimester. But even in second trimester, they'll ask for a note from us. We have a pre-prepared pregnancy massage note. So if you need one, just message one of us and we can have our OB coordinator email it to you. You can take it to them. She also has letters for dental cleanings and things like that. So keep that in mind. Most of your insurances will cover breast pumps. We have a company that makes it super easy for you and for us. So when you're around 20 weeks-ish, like after your anatomy ultrasound and you have a visit, scan the QR code in the room to have this company reach out to your insurance company, and they will send you a list of the pumps that are covered. You pick the one you want, they write the script, send it to us. All we have to do is sign it and send it back. Please don't go find your own company because they send us pages and pages and pages of papers that just none of them have anything to do with anything. This one makes it so easy, and you get your breast pump like really quickly. These other companies, the baby's here and eating chicken, and like you still don't have your breast pump. So please just use our company because I promise it'll get to you a lot faster. All right. Next, Leave Guru. If you need to take FMLA or if one of your family members needs to take Family Medical Leave Act guaranteed leave, we have decided to use a third-party vendor for that because any of you who have had these forms filled out in other offices before know that the process can take 7, 10, 14 business days. But we have found that with Leave Guru, most of the forms are completed in less than 24 hours, which is exactly what you want when you need to just give it to your HR person and be done. So when you're ready to take FMLA or sign up for it, please contact our office for details and we'll give you the information about going through the Leave Guru app. All right. Postpartum care. For my moms who have any issues with blood pressure during pregnancy, we'll see you about 1 week after delivery to make sure that we are not developing preeclampsia because preeclampsia is not just prenatal. And quite honestly, your most dangerous time for it is in the first 14 days after you deliver. For my moms who had belly birth, we're looking for incision check at about the 2 week mark. This is another place where we do our routine mental health screen. So at the 6 week mark, postpartum doulas, because remember, if they're there for emotional and physical support, when do you need it more than right after you bring the baby home? And the motherhood space is a referral that we may make during pregnancy or after delivery for an amazing resource in Jacksonville. It's like a play space for moms with free childcare covered by your insurance, with yoga therapy, walking on the woods at the Winston Y downtown. Just a beautiful setting. For those who are at higher risk for postpartum anxiety and postpartum depression. And then pelvic floor therapy is a standard here. So at the 8 week mark, typically, if whether you had a vaginal delivery or a belly birth, we refer to an in-house pelvic therapist, and she's here Tuesday, Wednesday, and Thursday, and will help put things back as close to where we found it as we can get it. Because babies do change things. Contents shift during travel, just like when you're in an airplane. All right. Random frequently asked questions. Yes, you can sleep on your left, right, back. If it freaks you out to sleep on your back or you wake up dizzy from it, you can get one of those wedge pillows off of Amazon, stick it under one of your hips so you can't roll all the way over. You can help paint the nursery. Just be sure you're in a well-ventilated space and or wearing a mask. Probiotics are fine during pregnancy. I got this question earlier today. Yes, you can dye your hair, and that includes your eyebrows. You can also do gel nails. If you're going to be in the salon, though, with a lot of fumes, you may want to wear a mask just to prevent yourself from getting sick or dizzy. Car travel, this is the summer and people are doing that. So it's fine up to 37 weeks. Please don't travel long distances after you are full term because you may end up delivering someplace that's not full circle, and that would be so sad. Be sure you're getting out to stretch, drink lots of water, and stretch your legs every couple of hours. Also, skincare. You can use your topical things as long as they don't have retinol. So your salicylic acid, your benzoyl peroxide, those things are just fine. If you need a retinol alternative, bakuchiol, Bakuchiol, is found. It's a vitamin A derivative that doesn't have the dangerous effects, the harmful effects of retinol on a pregnancy. Travel by flight, airplanes are fine for my twin moms up to 32 weeks, for my singleton moms up to 36 weeks. Just be sure, please, please, please be sure you are wearing your compression hoses, drinking your water, and doing your toe lifts, like your calf raises to exercise while you're in the seat to decrease your risk of developing a blood clot in your legs that can go to your lungs. Things you want to avoid, roller coasters and water slides. Don't go chasing waterfalls. Next question I have is what about pedicures? Pedicures are fine. I know some places won't do them in third trimester because there are pressure points that are associated with going into labor. Nothing's really been proven about that, but a lot of times they can just avoid that, and polish change is fine if you're worried about it as well in third trimester. All right, last thing we have is a COVID-19 update, and then I'm going to let you go. Thank you guys for rocking with me this long. ACOG moved from supporting either way to strongly recommending after the New England Journal of Medicine study of 35,000 pregnant women. Moderna and Pfizer are okay. They don't recommend Johnson and Johnson due to a risk of blood clots independently. Also, there's a risk of blood clots in pregnancy, so don't mix those two things together. I think next on here is for boosters. All vaccines are approved for boosters. So if you're planning to get a booster in the third trimester, you just need to be 6 months past your last Moderna or Pfizer, or 2 months past your Johnson and Johnson. But we don't recommend another Johnson and Johnson. You would mix and match because that is okay. There's no optimal timing for the vaccine against the flu, RSV, or Tdap because they work differently. If you do get COVID, there are no formal recommendations for ivermectin, azithromycin, or Plaquenil. We do ask that you do not come in here. I do hate that 2 people just dropped off the call. I certainly hope they do not get COVID because we are a well office full of immunocompromised pregnant women. We are a well office full of immunocompromised pregnant women. So please don't come in here if you have sniffles and fever and all of those other things, because one, you will infect our staff, and then there will be no one to take care of you. And two, you may infect other pregnant women who are immunocompromised and unsuspecting. They're just here to hear their babies. What is recommended is you can convert your visit to virtual and start your vitamin D3, your zinc, your vitamin C. And if you are under 36 weeks, you can start a low dose aspirin to reduce inflammatory changes and reduce your risk of conversion to high blood pressure or pregnancy, which we have seen for moms who develop COVID during pregnancy. At the time that you're diagnosed, about 4 weeks later, we'd start doing growth ultrasounds to make sure that vascular connections with baby are still intact and we're still growing well. If you do contract COVID after 36 weeks, don't start the aspirin because you'll increase your risk for bleeding at delivery. The recommended course of action is just supportive treatment at home. Remember, our website has information on congestion and sore throat and cold and all that other stuff. You only need to go to the hospital if you're having respiratory issues, like if you're having trouble breathing or you have a fever that's over 101 that you're having trouble breaking with Tylenol. Or your pulse ox, like you don't have to get a pulse oximeter. If you can't breathe, go to the hospital. Like don't wait for something to come on Amazon to tell you that your oxygen saturation is low. All right. We are back to our regular pre-COVID visitation at the hospital and activity. So you can still have 4 visitors in the room plus your DONA certified doula. We're not wearing masks in the room or in the hallways or in labor unless you are actively COVID positive while you are in labor, which is miserable. And if you have COVID when you are laboring, we do not separate moms and babies. We give you an isolette to use while you're in your room so baby's not exposed to your respiratory droplets in the room, and we encourage the use of N95 masks, but we don't separate you, and we do encourage breastfeeding. All right, last question. What can you find on the website? Can you find the template for the birth plan, safe medications in pregnancy, what to expect at your visits, or are you a master test taker and have to read all the way to the end to find the all of the above? Excellent work, team. All of the above, 5, 4, 3, 2, 1. Thank you guys so much. That is the end of my presentation. Please remember that we are social, so follow us on all the things. And we are always looking for amazing rock star stories to inspire future mamas. So thank you again for choosing Full Circle. I appreciate each and every one of you giving me part of your evening time because you care about you, and so do I. So we'll look forward to seeing you guys in the office really soon, and take care. Bye.